Neurogenic voiding dysfunction is a condition where the nervous system fails to properly control the bladder, often resulting from spinal cord injury or stroke. This means patients may experience urgency, leakage, or difficulty emptying their bladder. If left untreated, these problems can lead to infections, bladder damage, or even kidney issues. This video will walk you through how neurogenic bladder dysfunction develops, how it's diagnosed, and the main treatment strategies. You'll focus on the most common causes, spinal cord injuries and strokes, and highlight the importance of a collaborative medical approach to improve patient outcomes. Bladder control relies on a complex interaction between the brain, spinal cord, and peripheral nerves. The prefrontal cortex in the brain helps suppress the urge to urinate until it's appropriate. The brainstem coordinates the relaxation of the urethral sphincter and contraction of the bladder muscle. The spinal cord acts as a bridge, integrating signals and generating reflexes for either storing or emptying urine. Parasympathetic nerves trigger bladder contraction, while sympathetic nerves help store urine. This precise coordination is essential for normal urination, and any disruption can lead to dysfunction. After a neurological injury, the body's ability to recover bladder control depends on neuroplasticity, the nervous system's capacity to reorganize and adapt. As the nervous system matures after birth, people learn to control their bladder. When injury occurs, such as in spinal cord injury or stroke, neuroplasticity can help patients regain some bladder function through rehabilitation and therapy. This process is crucial for improving quality of life and reducing complications. Location of the neurological injury determines the type of bladder dysfunction. Injuries above the sacral spinal cord, S2, S4, often cause overactive bladder, leading to urgency, incontinence, and involuntary contractions. This is due to the loss of inhibitory control from the brain. Lower spinal cord or cauda equina injuries result in an underactive bladder, where the bladder muscle is weak or unresponsive, causing urinary retention. Both types can be complicated by poor coordination between the bladder and sphincter, known as detrusor sphincter dyssynergia. Stroke can also disrupt bladder control, especially when the dominant hemisphere of the brain is affected. This often leads to an overactive bladder and incontinence. In contrast, strokes in the non-dominant hemisphere tend to cause milder urinary symptoms. The loss of cortical control is a key factor in these changes, and treatment must be tailored to the individual's specific neurological deficits and overall health. Neurogenic bladder is classified as either reflex spastic or flaccid tonic. Reflex bladder is linked to upper motor neuron lesions and is characterized by involuntary contractions and incontinence. Flaccid bladder, on the other hand, occurs with lower motor neuron lesions, resulting in weak or absent contractions, urinary retention, and incomplete emptying. These distinctions are important for getting treatment and predicting outcomes. Patients with neurogenic bladder face significant risks, including urinary tract infections, UTIs, kidney damage, and bladder stones. Catheter use and residual urine increase the risk of infection. Vesicoureteral reflux, where urine flows backward from the bladder to the kidneys, can cause serious kidney damage. Preventing these complications requires careful management, regular monitoring, and sometimes surgical intervention. Diagnosing neurogenic voiding dysfunction starts with a thorough medical history and physical exam. It's important to distinguish between irritative symptoms like urgency and frequency and obstructive symptoms such as weak stream or hesitancy. The neurological background is also reviewed to identify any prior injuries or diseases. This helps clinicians determine the type of dysfunction and plan further testing. During the physical exam, doctors assess the sacral reflex arc, which controls the pelvic floor and sphincters. They check reflexes like the anal and bulbocavernosus reflexes to determine if the sacral spinal cord segments are functioning properly. Changes in these reflexes can signal neurological damage, affecting bladder control. Evaluating perineal muscle tone also helps identify neuromuscular problems that could impact continence. Get a complete picture. Doctors use tests like renal and bladder ultrasound to spot structural problems and measure residual urine. Uroflowmetry records urine flow patterns, helping to identify coordination issues. Urodynamic testing is the gold standard, providing detailed information about bladder pressure, capacity, and muscle behavior. In some cases, cystoscopy is used to look for anatomical abnormalities in the bladder or urethra. Managing neurogenic bladder dysfunction requires a comprehensive approach. Patient and caregiver education is crucial, especially about catheterization and recognizing UTI symptoms early. Regular urine tests, ultrasounds, and urodynamic studies help monitor kidney and bladder health. Conservative treatments include bladder retraining and pelvic floor exercises, while clean intermittent catheterization remains a cornerstone for many patients. Pharmacological treatments include antimuscarinic agents and beta-3 agonists to control overactive bladder symptoms. For urinary retention, alpha blockers and cholinergic agonists are used. Botulinum toxin injections can reduce involuntary bladder contractions, and sacral neuromodulation offers hope for patients who don't respond to other treatments. In severe cases, Surgical options like bladder augmentation or urinary diversion may be necessary. Urinary tract infections are a major concern for patients with neurogenic bladder, especially those using catheters. Proper catheterization techniques, rational antibiotic use, and regular monitoring can help prevent infections. Chronic kidney disease is another serious risk, often linked to high bladder pressures and incomplete emptying. Regular follow-up with renal and urodynamic tests is essential to catch complications early and adjust treatment as needed. Effective management of neurogenic bladder dysfunction relies on a multidisciplinary team. Neurologists assess neurological aspects, urologists oversee diagnosis and treatment, and physiatrists design rehabilitation plans. Nurses provide daily support, education, and monitor for complications. Occupational therapists help patients adapt their environment and daily routines. This collaborative approach ensures comprehensive care tailored to each patient's needs. Rehabilitation programs for neurogenic bladder are highly individualized. They combine physical therapy, occupational therapy, and patient education to restore function and improve quality of life. The extent of neurological damage and specific patient limitations guide the design of each rehabilitation plan. The goal is to maximize independence and prevent further complications, making ongoing assessment and adjustment essential. Neurogenic bladder dysfunction is a common and serious complication of spinal cord injury and stroke. Its presentation depends on the location and severity of neurological damage. Accurate diagnosis requires a thorough clinical evaluation and advanced testing. Treatment is most effective when delivered by a multidisciplinary team with a focus on patient education, regular monitoring, and personalized rehabilitation. By working together, healthcare professionals can help patients maintain their health and quality of life.